Okay, guys, good morning. So let's continue discussing the chapter 5 of your book. So let's discuss the specific ethical issues that we are dealing in our workplace or when we're talking about our profession. So the first one that we really have to discuss is acquired immunodeficiency syndrome or such thing that we called AIDS. So it bears social stigma. So the questions arise whether testing of providers and clients should be mandatory or voluntary and whether the test results should be released to companies. Because somehow guys, di ba, when you are being tested by AIDS or somehow sexually transmitted infections, supposedly it should be confidential. It should be kept in private since it's a personal information. It could be degrading. Yeah, it also creates social dilemma. But somehow some of the companies are requiring the test institution to release the information or the result to the companies that the particular employee is working. So that's somehow a social dilemma that we are currently experiencing. The second one would be abortion. So it debate continues between sanctity of life against the principle of autonomy. What is autonomy? It's a patient self-determination because there are some saying na a woman can actually decide whether to pursue her pregnancy or just terminate it because that's a matter of patient self-determination. But somehow some of the people would like to say that we have to respect the sanctity of life, which is the fetus. And then next would be organ and tissue transplantation. Organ and tissue transplantation. So many living people choose to become donors by giving consent under the Uniform Anatomical Act. So a person's religious belief may also present conflict. Example would be that certain religious belief forbid the mutilation of the body even for the benefit of the person. So there are some beliefs of some individuals who actually they will not favor the organ transplantation because they believe that mutilation of the body is prohibited in front of God or somehow that's their own belief. And the next one that you have to cover for this chapter is that such thing that we call euthanasia and assisted suicide. So when we say euthanasia, it comes from the Greek word good death and popularly known as mercy killing. So there are some clarification or some sub concept under euthanasia, which is what we call active euthanasia, which action brings client to death with or without client consent. So, pwede na consent ng client or pwede wala. So, like administering lethal medication, always remember that it's forbidden by the law and can result in criminal charges like murder. So, all states in America, active euthanasia, like you administer lethal medication, it's not actually it's not actually allowed in the US right now. So once you committed to that particular thing, you will be charged by murder. And there's a variation of active euthanasia. The first one is what we call assisted suicide, like giving the client the means of killing themselves. Example, you provide the clients pills, like you provide them para, para mamatay sila because you are just an accomplice. Although wala ni mo kay directly o administer, but you allow the client to take it for them. So you allow them to take it and then it may lead to death. So this type of suicide, which is assisted suicide, is currently legal in states of Montana, Oregon, Vermont, and Washington. So there are some selected states in America where it's allowed, but somehow 80 to 90% of the states there are not allowing this assisted suicide. The second one is what we call passive euthanasia. When we say from the word passive, it referred as withdrawing or withholding life sustaining therapy. Like for those clients of us who are suffering from terminally stage illnesses like cancer, like they are being comatose for so many months. So somehow withdrawing or withholding the life sustaining therapy. For example, removing a mechanical ventilator. So once you remove the mechanical ventilator, it's like a machine that allows the pumping of oxygen towards to the body of the patient. So once you remove it, that may lead to death. So somehow, this passive euthanasia may be both legally and ethically more acceptable than active and assisted suicide. So somehow in some of the states in America, they usually practice passive euthanasia as per discretion by the family and the doctor. So for example, I am the guardian of my patient, so I don't want my patient to suffer anymore because he or she is actually in a stage wherein malabo na gyud siya makarecover. So that's why withholding the treatment like MECVENT would facilitate good death. So that somehow is applicable and allowed in United States of America. But here in our country, it's not really applicable and we are not doing that at this moment. So that's it. So that's the end part of chapter 5. And for now, you have to stand by and you have to learn everything and just take note everything at your notebook as much as possible so that during your quiz, you will of course get high grades as much as possible. So thanks for guys for listening and have a good day.